Good day, everyone. Today we are going to discuss on what is management and its theories. Our objectives are define management, describe how management has evolved as a field of knowledge, theory, and practice, identify the concept of management, compare administration, management, and leadership, discuss the theories of management, and discuss the functions of management. The practice of management can be traced to the 19th century. The development of management as an academic discipline based on a body of knowledge is generally attributed to the work of Peter Drucker in the latter half of the 20th century. That body of knowledge is taught in business schools and programs in healthcare organizations such as hospitals and clinics. So in this topic, we will be able to determine the basic introduction to management, its concept, and theories. The concept of management. Management is the coordination and administration of tasks to achieve a goal. The following are some common definitions of management by famous writers. According to Harold Kuntz, management is an art of getting things done through people in a formally organized group. According to Robert L. Trulli and M. G. Newport, management is defined as a process of planning, organizing, and controlling an organization's operations to achieve coordination of the human and material resources, which is important in the attainment of objectives. On the other hand, Kreitner defined management as the process of working with and through others to effectively achieve organizational objectives by efficiently using limited resources in the changing environment. And according to Frederick Taylor, management is the art of knowing what to do, when to do, and see what is done in the best and cheapest way. So management is an art of creating an environment in which people can perform and individuals can operate towards the attainment of group goals. It includes activities of setting the strategy of an organization and coordinating the efforts of its employees to accomplish its objectives through the application of available resources such as financial, natural, technological, and human resources. So managers are judged by their organization's performance. The way managers set standards, coordinate and integrate work groups, make decisions, and design the organization which affects performance. To be an effective manager, one must need to develop a set of skills including planning, communication, organization, and leadership. An effective manager must also need extensive knowledge of the organization's goals and vision and how to direct employees, sales, and other operations to accomplish them. Management versus administration and leadership. These terms are often used interchangeably, but they are different in several ways. For a student in management, it is important to distinguish these terms to avoid confusion in the future because these terms are often used simultaneously. Therefore, it is important to understand their differences to isolate its functions more effectively. Management versus administration. Management and administration have two distinct functions. Management is the operational part of the administration. The management performs departmental planning, organizing, staffing, and controlling. Meanwhile, the administration is mainly responsible for the following: formation of policies, plans, and procedures, setting up of vision, mission, goals, and objectives, and implementing rules and regulations. Management is concerned with the day-to-day operations of the organization, while the administration lays down the fundamental framework of the organization. Therefore, the administration is only concerned with the formulation of the organization's major goals and objectives, whereas management is the body that operates to achieve those goals and objectives by following the policies and plans formulated by the administration. In other words, the administration is the body that makes the policies, while the management is the body that implements the policies set by the administration. Management versus leadership. The terms management and leadership are also mistakenly used interchangeably, but these two things are somewhat different. It is important to understand that leadership is essential part of an effective management. Leadership is defined as the potential to influence and drive the group efforts in accomplishing a certain goal. A manager must have the traits of a leader. Leaders motivate and develop their employees. Organizations require effective leadership and management for efficient operations. Leadership differs from management in ways that, while managers delegate authority and responsibility, leaders provide direction by inspiring and motivating the employees to achieve a certain goal. While management focuses on planning, organizing, staffing, directing, and controlling, leadership focuses on listening, teamwork, building relationships, inspiring, and motivating the employees. A manager gets authority by virtue of his position in the organization, while a leader gets his authority from his followers. While a management follows the organization's policies and procedures, a leader follows his instinct. Management is more of a science, as the managers are exact, planned, and logical. Meanwhile, leadership is an art of achieving progress through the involvement and actions of others. Importance of management in healthcare. Healthcare is one of the fastest growing industries, and as the number of jobs in the industry rise, so does the need for healthcare service managers. Healthcare service managers are typically responsible for planning, coordinating, and directing the delivery of quality service to patients in hospitals, clinics, and any other healthcare organizations. So these roles require a strong balance of healthcare knowledge and business skills to keep facilities safe, efficient, and profitable. The healthcare service managers team consists of management personnel, medical doctors, and allied health professionals. Each profession has each role in providing quality patient care. These professions use a unique blend of skills for working with both internal teams and patients. So they not only have to know how to communicate with the healthcare professionals, but also with patients and their families. Now let's move on to the theories of management. The Scientific Management by Frederick W. Taylor. Management began to develop as a body of knowledge more than a century ago with the scientific management work of Taylor. In his work, he claimed that management is not only made up of theory, but it is a source of knowledge from the applications within the factory and continuously evolved. To increase productivity, Taylor introduced the collaboration between the manager and the workmen, as an essential principle in the implementation of Taylorism. So if the collaboration between the manager and personnel working the organization is not attained, other methods and techniques are of little use. In the scientific management approach, production processes are broken into small units, and employee and material movements are studied to find the most efficient way to perform each job. So these subtasks are meant to make the process more organized and efficient, with multiple employees working on one assignment. So although the scientific method seems to adopt the increase in production, it endeavors to solve the problems between the manager and the workman. So Taylor's ideas became known as Taylorism and scientific management. This approach to management was further developed by Frank and Lillian Gilbreth and Henry L. Grant. Gilbreth's work included a series of surgeons which lead to creating the surgical nurse job to assist the surgeon and the use of tray to hold instruments. The followers of Taylorism later realized that the best way to perform a job depended on the worker's experience, the work situation, and other factors. The principles of scientific management are still used today in many organizations, including healthcare industry. The Bureaucratic Theory of Management by Max Weber. According to the bureaucratic theory of Max Weber, bureaucracy is the basis for the systematic formation of any organization and is designed to ensure efficiency and economic effectiveness. So it is an ideal model for management and its administration to bring an organization's power structure into focus. So with these observations, he lays down the basic principles of bureaucracy and emphasizes the division of labor, hierarchy rules, and impersonal relationship. He suggested an ideal model for management as a bureaucratic approach. Weber postulated that the ideal organization was a formalized, somewhat rigid bureaucracy that had rules everyone in the company obeyed, and in which people were given positions based on competence. Also, clear and formal hierarchies established chains of command for decision-making and division of labor was in place to allow employees to align their skills with work needs. Weber defined bureaucracy as an organizational structure that is characterized by many rules, standardized procedures, processes and requirements, number of desks, the meticulous division of labor and responsibility, clear hierarchies, and professional, almost impersonal interactions between employees. So his bureaucracy theory was widely perceived as an improvement over the nepotism, irritational behaviors, and lack of professionalism that existed in organizations during that time.